You're watching the Microsoft US Health and Life Sciences Confessions of Health Geeks podcast, a show that offers industry insight from the health geeks and data freaks of the US Health and Life Sciences industry team. I'm your host, Claire Bonacy. Today we begin a health plan series with Sam Robinson, our National Director for US Health Plans, discussing social determinants of health and the biggest myth he wants to clear up about SDOH. Hi, welcome Sam, our health plan expert. Thanks so much for joining us today.
Well, thanks, Claire. Thanks for inviting me on the podcast.
Yeah, of course. So we have been hearing a lot about social determinants of health, or SDOH, and often SDOH is conflated with population health. Can you explain what SDOH means from a health plan perspective and give our listeners a quick rundown on the differences between the two?
Yeah, let's start from the beginning. Social determinants of health are really a way to collect and measure the factors that happen to you and affect your healthcare and your health expenditures outside of what happens within a care setting. So think of a care setting as you go to the doctor, you go to the hospital. Outside of that, your diet, your exercise, all the things that you've been told by your doctor all these years, that actually affects your overall health and also your health expenditures. Generally, we break down social determinants of health into some very broad categories now that it's getting a lot more attention. Economic categories, think of income as the major driver of that. Another closely related to that is education. So first of all, we don't have much of a literacy problem in this country, but we have some. Can you read, can you understand in the language that is presented to you? Can you understand what people are telling you within the health system? Big problem. Then in addition, we do find higher your education level, the different experiences or how you're going to consume resources. Environmental factors are huge. Pollution, noise, light pollution, all that affects your health outside of it. So, do you live in an environment that's conducive to that? Food. You're hearing a lot in the news now about how do we get food to people who need it. The term they use is food insecure, for example. What that means is that you don't know where you're going to get healthy food at an affordable price day to day. And social. And social covers a lot. I know we're on a bit of social media here, but it's what is your support environment? Do you have people that could bring you food that can make sure you're taken care of, that your prescriptions are being taken care of? And lastly, health itself. I know that gets the most attention, but do you have access to providers, to hospitals? Are you covered? Do you have insurance? All those factors, and even literacy again. How much do you understand when someone's talking to you about the health insurance industry, what that means, or the health provider industry, what that means? And these factors can determine lots of things. So at a population level, so you mentioned population health, population level, where do I need to address programs? Where do I need to help people who are in specific areas that may need more food, may need more services? And secondly, on an individual level, gosh, if I could measure everything that happens to you outside of the healthcare system, could I design programs or know your ability to take up programs that would help your overall health outcomes?
That's great. I also love that you bring up healthy food, not just food, and then the mental health piece of, do you have a support system? Do you have people around you? Those are very important. I love that you bring that up. Great. So these ideas of SDOH, social risk factors, and population health are not new. So why do you think that these terms are now entering the mainstream of US health markets? Why now, basically?
Well, there's lots of reasons. First, health, like every other part of our society, is trendy, right? As soon as we got an acronym, we could make it SDOH that you just said, right? Thank you for that. That SDOH acronym, everyone wants to do it. And every company, provider, vendor of any sort is now jumping on the SDOH bandwagon. But more importantly, it gets at a very core concept. We talked about population health, and often it's conflated, population health and social determinants. And you hear that a lot when you talk to folks. Well, aren't they the same thing? No, in fact, population health is for a given group of people, however you want to define them, geographically, maybe by employer, however you define them. How can I maximize the health outcomes of that entire group, right? And then when we look at that, then we look at the second part of population health, which is, are we equitably putting resources to that group to give everyone a similar health outcome, right? SDOH, on the other hand, is a way of getting that additional information and moving that into that process so that we can distribute resources within that population to raise everyone's health. And this has implications for individual health, for overall expenditures, all the way through to even a pandemic where you want to know who needs what resources when to maximize their health outcome, but also maximize what the entire population is doing. Because as we've seen now, but we see all the time, your health affects everyone else and everyone else's health affects yours. So we all should be in the business of population health because we want to raise everyone's health to a new standard.
Okay. So these factors are actually really helpful to health plans and health systems to help the community overall.
Absolutely. Absolutely. It is what they do day to day. You could even say that a health plan is in the business of population health.
So Sam, as health plan initiatives related to social determinants of health grow, and there is a greater clarity around these concepts, what factors are needed for a strong implementation and evaluation?
Sure, I'll give you the top 3 factors: data, data, and data. We need the data. So what's really interesting is it's caused a revolution in the business. So these are new data sources. Some we've had around, but not at this level. So think of zip plus 4 information. What are people around you? And believe it or not, we tend to group as people. So your neighborhood that you're sitting in right now, watching this, is going to affect generally who you are. So generally it tells us income level, generally eating habits, health habits, exercise habits, things of that nature. So that information is great. We've had it, but now combine that up with new data, fitness data, other data that comes in. Well, that's great. We have all these new sources. What we're finding is they have to be combined with existing experience sources. So what is your care sources, right? From providers, clinical information, claims information. And that generally is used for a transactional purpose and hasn't been digitized in a way that we can actually combine it with other sources. It might be digitized into a data warehouse that you've had for 30 years, but isn't that useful. But now combining that up into the holy grail, which we call the longitudinal record, health record, or longitudinal record of you, incorporates that, and even other sources like your social media, if you'll let us get it. Then measuring that and saying, how did we do? We expected them to use this program. Did they do it? And that gives us what? More data, right? And how do we combine that now performance data back in?
Okay, great. Yeah, it just comes down to insights and data. That makes sense.
That's right. Simple.
Sam, we have 1 minute left. What's the biggest myth about SDOH that you want to address?
Well, that is the next silver bullet. We talked about that right at the very beginning. We love a trend. We love to bring things in, but it's not, there is no silver bullet. We have a very complex payment and delivery system in this country, and it's all mixed into winners and losers, and it makes it difficult. But what's key about social determinants of health is it's changing the conversation from how do I do better healthcare delivery, i.e., how do I deliver a service better? How do I get people out of the hospital quicker? How do I avoid hospitalizations? All care, and that's important in disease management, to health outcomes. How do I make sure everyone in my population is reaching their maximum health potential? That is fantastic for us as a country, for health payers specifically, and even eventually for providers once they adjust to that new health outcomes mantra. And through payment mechanisms like value-based payments and other things, we're starting to move the needle a little bit. But SDOH provides key information that will help us deliver on health outcomes and truly make it an affordable proposition for everyone in this country, not just those who can afford it.
Great. Well, thank you so much, Sam.
Thank you for having me.
Thank you all for watching. We look forward to having Sam back next month. Please feel free to leave us questions or comments below, and check back soon for more content from the HLS industry team.